first one is going to be the clamshell. The legs are bent. You want to make sure the band is right around the knee. And you're pressing straight up. You want to make sure the hips are stacked. You're not turning over or going forwards. Feeling for the glute muscle to start engaging. You just go as high as you possibly can and you go slowly on the way down until you feel a good burn, whether it's 10 or whether it's 20. You want to make sure the core is engaged as well, nice and tight. So you isolate the hip. So this one's a little bit more challenging. This one, it's more challenging because the band's all the way down at the feet. So what you want to do is you want to make sure the hips are stacked once again. You want to make sure that the foot is not going outwards. You want to make sure the toes are pointed straight to the wall, almost leading with the heel. So that's where you're really going to get the best contraction in the glute. Great for just getting that muscle engaged and primed, which is super important if that muscle is not functioning. And once again, you just go to burn, and then after you're done, you switch sides, you go to the other side. Or if this is the side that the therapist has instructed you to work on, then just focus on the one side. So the next exercise is we're going to do a wall squat. So make sure the legs are quite a bit forwards here. Core is nice and engaged, tucked in. You're coming down and you can hold for a little bit. But the key is what you want to do is you want to push through the heels. I don't necessarily want the burn out here on the outside. I want the inside muscle working, and you're engaging that core, belly button towards the spine, and you're holding right through the heels, holding. I want it nice, burn right in there, and you're pushing through. Good. So another exercise here, considering that let's say we're working on strengthening the left glute, get the legs level, and we're just gonna drop the right hip and pick it up with the left side. Drop. At the same time, even though I'm working this area here, my VMO muscle is also working to stabilize the femur. One of the compensations I see people do is they overcompensate by bending. So that's why I keep that core engaged, nice and tight, and you're just getting most of that motion right from the hip. So you do that one till you feel the muscle right here and inside working and burning, and then you stop. And once again, you can do it on both sides. So the lunge exercise, some of the important key points is you want to make sure the leg is not too close into the center, the closest center of the body. And bring it out a little bit. And what we want to do with the lunge is all we're going to do is we're going to drop down. And once again, this is a lunge that focuses on glute more than the quads. We're just coming down. And some of the things to look for is you want to translate as much weight onto the left side as you possibly can. And you want to just drop straight down and then drive through the heel. And you're coming down. And again, and you want to make sure you're nice and tall, core is engaged once again. And you're pressing down. And then you can add a little bit of weight if you want on the opposite side. This is more like a split squat. You can turn into a split squat. This is a little bit more challenging, this one here. Once again, core is engaged, and that's going to get the VMO going a little bit more. Okay, so this is another great exercise for this hip and these muscles right in here. So the VMO and the glute med. All we're going to do is just stand in this one position, engage the core, stabilize through this leg, and push with the right leg. And the more pressure you apply to the wall with this leg, the more you have to stabilize through this side. And so this is a great exercise. Engage the core and you relax, and then you push in again. And that's going to work on engaging your VMO and your glute med without necessarily putting a ton of stress through the joint. Now what you can do is you can also add a little bit of a squat once you get a little bit more advanced. And get a bit more of that. There we go.